Welcome to the DVERT Brief. I'm Dr. Meg McBride, Director of the Domestic Violent Extremism Research and Translation Center at CNA. This podcast series highlights new research, trends, and findings on violent extremism in America. Designed for policymakers, practitioners, and anyone curious about the evolving domestic threat landscape, this AI-generated podcast delivers concise and accessible summaries of our latest work. Thanks for listening.
In today's episode, we'll be exploring key insights from our report BTAM, a deep bench of resources. Let's dive in. Today we're focusing in on behavioral threat assessment and management, BTAM. It's a systematic process that aims to identify, assess, and manage people at risk of committing acts of targeted violence.
CNA's evaluation really highlighted a critical point for these programs. The main finding, the core thing, is that successful BTAM needs a team with a deep bench.
A deep bench?
Exactly. As one practitioner actually put it, this is a systems-based problem that needs a systems-based solution. It's not just one agency's job.
Right. And I think that framing is so helpful because it underlines that prevention is much, much wider than just a law enforcement thing. So if it's a systems problem, what kind of resources specifically make up this deep bench that's required?
Well, building that system means realizing just how many different viewpoints you need. Think about the 2019 Colorado Preventing Targeted Violence Summit. They got together over 75 people from like 40 different organizations, state, local, federal, nonprofits, academics.
Wow, that's a lot of coordination.
It is. And a big part of that was just getting everyone on the same page, building a shared vocabulary. It shows you the kind of breadth you need just to start talking effectively.
Okay, so that's the big picture collaboration. But looking specifically at Wood County's efforts, particularly with juveniles, what services were they using most often? Who was on that sort of core team?
Yeah. On the ground level, the people almost always involved are your licensed mental health providers, naturally, school resource officers, school administrators, school counselors, and social workers, too.
Okay, the usual suspects in a school context makes sense.
Right. And their main role involves mental health assessment and providing general mental health services. They're really the essential frontline team.
But the deep bench idea really comes into play with those more complex, high-risk cases, right? The ones needing specialized help that might be regional. What are those kinds of resources?
These are resources that address complex needs the core team just isn't equipped for. We're talking highly specialized stuff, often not available right there locally. Things like, say, neuropsychological assessment, which is really crucial for understanding a person's cognitive or emotional state. Or things like residential treatment services, diversion services to avoid justice system involvement, or substance use disorder services. These are the tools the core team absolutely needs to be able to reach for when they've sort of hit the limit of their own resources.
So if you're a policymaker listening to this, trying to design a BTAM program that actually works long-term, what are the key takeaways here? Because it sounds, frankly, expensive and complicated, to keep ties with specialists, you might only need once in a blue moon.
It can seem that way, but there are really two key implications from this. First, you have to proactively build a broad community of stakeholders. Success hinges on having established relationships that allow for information sharing. For example, one county held specific workshops just on managing mental health care for high-risk cases. The whole point was getting different agencies talking because, well, as we learned, a lot of information sharing is relationship building if you don't have that trust beforehand.
The information just stops flowing when things get tough. Okay, that makes perfect sense for the everyday team. But what about that second implication? Focusing on those, specialized, rarely used people, like providers offering specific LGBTQIA plus group treatment. Why bring them in early if you might not need them often?
Because trying to build a brand new trusting relationship with an outside resource like mobile crisis care or that group treatment provider right in the middle of a high-stakes emergency is incredibly difficult, maybe impossible. Including these specialized resources right from the beginning lets everyone learn the BTAM process together. It makes sure they know the protocols and they know the team. It smooths the path for access when that really critical emergency does happen. The whole system can break down if your specialized bench doesn't even know the playbook.
That's a really powerful takeaway. So effective prevention isn't just about the resources you use daily. It's maybe even more about that specialized regional network you consciously build before you ever think you'll need it.
That's the essence of the deep bench, yeah.
This podcast was produced with the assistance of artificial intelligence tools, but the content was based on research done by the DVERT Center, which is housed within CNA, a nonprofit research and analysis organization dedicated to advancing the safety and security of the nation. The research on which this podcast is based was supported by the Department of Homeland Security Science and Technology Directorate. Adaptation of this research for the DVERT Brief was supported by the National Institute of Justice. The views and conclusions contained in this podcast are those of the authors and should not be interpreted as necessarily representing the official policies, either expressed or implied, of DHSS&T or the National Institute of Justice.